A single-payer plan from Bernie Sanders would probably still be expensive. Bernie Sanders's chances at enacting a political revolution are all but gone. But that doesn't mean his policy agenda won't continue to be felt in this election or future Democratic platforms. One of his signature proposals is to move the country's healthcare system to a government-run, single-payer system. Last week, Hillary Clinton nodded in that direction, suggesting that she would be open to allowing Americans older than 50 to buy into the government Medicare program that currently covers those 65 and older. But also last week, a detailed analysis of the Sanders healthcare plan from researchers at the Urban Institute showed that it would probably cost the government double what the campaign proposed. It is the second credible analysis to suggest that the Sanders plan costs more than advertised. The other comes from the Emory health policy professor Kenneth Thorpe. The Sanders plan is light on some key details, but even in sketch form, it seems clear that it would require even bigger tax increases than the sizable ones the campaign has called for. If you look around the world, lots of countries have single-payer systems. And all of them pay substantially less for health care than we do in the United States. I am reminded of this often, in the comments by readers in some of my articles. So how could a single-payer system here still be so expensive? One reason is that the Sanders plan covers far more than typical insurance plans in the United States, or abroad. The Sanders plan would charge no premiums, require no out-of-pocket spending, and would pay for services like dental care and long-term nursing home stays. Those things boost the total price tag. But imagine a universe where we had a single-payer health plan that was more like normal insurance. Perhaps it would be a true Medicare for all, where everyone has exactly the insurance that the federal government currently provides to older people and the disabled. That Medicare for all plan would still cost more than single-payer plans in other countries. Here's why: Medicare pays doctors and hospitals higher prices than single-payer systems do in other countries. The big thing is that providers here make quite a bit more money than they do anywhere else, and in order to get in the ballpark of where these other countries are, you'd have to reduce payment rates to physicians to much, much lower levels, said John Holohan, one of the authors of the Urban Analysis. That's just hard to do. The Organization for Economic Cooperation and Development, which looks at a group of developed countries, has found that the United States pays substantially higher prices for doctors, hospital stays and prescription drugs than the rest of the group. Medicare pays less than the United States average, but not enough less to make up that difference. Making the American healthcare system significantly cheaper would mean more than just cutting the insurance companies out of the game and reducing the high administrative costs of the American system. It would also require paying doctors and nurses substantially lower salaries, using fewer new and high-tech treatments, and probably eliminating some of the perks of American hospital stays, like private patient rooms.